Okay. So, which of the following is the most appropriate treatment for this patient? Okay, so chief of complaint is a 28-year-old woman with a history of atopic dermatitis, presents a primary healthcare physician with worsening rash on her hands. She states that the rash is itchy and has become more severe the past few weeks. On examination, the physician observes a erythematous scaly patches with small vesicles on the palmar surface of her hands. So at this point, I want to make a diagnosis.
Okay, good.
Um, so obviously it does say like a history of atopic dermatitis. But it is scaly. Uh, with small vesicles. This wouldn't be scabies, I know that, because those are like bumps. Atopic dermatitis. So I want to say it could be definitely not fungal or anything like that.
Okay. What do you want to go with? I want you to tell me a diagnosis that you can kind of back.
I think it's another type of dermatitis for
Okay.
sure.
Okay.
Um, over the past few weeks. So definitely not anything sun related
Okay.
because of the palmar surface of her hands. Actually, it could be fungal. I just want to say it's like a dermatitis.
Okay. Okay. So you're sticking with dermatitis. What do you want to do for this dermatitis?
So with this dermatitis, I would want to give it a topical corticosteroid.
Okay.
Um, yeah, just because it could be fungal. I just don't I just don't think it can be. I don't think we need oral corticosteroids for that. Calcineurin inhibitors. I don't remember what those are used for, and topical antibiotics, I don't think so either. So I'm gonna go with
Okay.
that.
Yeah, let's talk about this, right? So, history of atopic dermatitis, right? She has erythematous, scaly rashes with small vesicles and palmar itchiness and just flare up of atopic dermatitis. So, this is just atopic dermatitis.
Mhm.
Okay. So, I like kind of how you're working through this, right? You have to remember, right? I want you to think to yourself, right? You're looking at the history, right? And this is a chronic thing, right? So, 28-year-old young female already has a history of atopic dermatitis, right? With worsening rash on her hands. The rash is itchy. Remember, atopic dermatitis just means eczema, right? So, the
Mhm.
rash is itchy. It has been worse over the past few weeks. So, this is a chronic issue. So, it's not, acute. And then they describe the rash, which is erythematous, scaly patches, small vesicles on the palm surface of the hand, which that's just there atopic dermatitis has some vesicles, some patches. Sometimes they're very, very itchy. So the treatment of that is you're going to give steroids to it. Antifungal doesn't work here. Remember, if you have athlete's foot or something like that, it's usually in a ring. It can have some scales in it. It can be itchy, but patients will notice it. It's not going to go on for weeks, right?
Mhm.
It can if you don't treat it, of course, but patient will probably come in earlier than that. Oral corticosteroids, right? That's an overkill, right? You want to actually treat it with something topical. Topical calcineurin inhibitors, right? This is more like what is it called? Immunomodulators that are topical, and then antibiotics. She doesn't have like a bacterial staph infection or something like that. So best answer here is going to be A.